Test, test, test. Test, test. What? Oh, test. There we go. Okay. I got really quiet. Really quiet. Hi, everybody. I'm Amy McKeever. I'm the case management director here at Colorado Blue Sky. Just got a couple housekeeping things. If you have a question, if you could please wait for a microphone so that everybody online can hear you, because they have a hard time just hearing when we don't use microphones. And then if you want to mute your cell phones for us, that would be great also. Bathrooms are out either door and down the hall. So if you need the restroom, and then we've got some water and cookies in the back.
Oh. Hello, I'm Julie White, Marketing and Communications Manager with the Resource Exchange.
Hello, I'm Heather Mazes, Manager at TRE.
Hi, I'm Megan Lawrence, Supervisor of Service Coordination at TRE.
Hi, Janine Gonzalez, CES and CHIRP Coordinator at TRE.
Nancy V. Hill, Director of Navigation and Quality at the Resource Exchange.
Hi, everyone. Anthony Shibata here with Whipley. We're a partner with Blue Sky and TRE during the transition.
Awkward. I don't like this. I don't dance, I don't sing. I would scare you all. No, but thank you all for coming tonight. We wanted to be sure that we had at least one more member town hall with you all to answer any questions you may have, talk about some more updates that we have kind of worked out in the process. I know there a lot of members, you all might have a lot of questions, and we're hoping we can answer as many as possible tonight. The first thing I wanted to talk about was the Resource Exchange's website. Now, we do have our website up. Matt, is there any way you can pull that up, please, again? Our website is www.tre.org. And scroll down, please. And click on that right there. Yep. You will see on our website, we have frequently asked questions on this page if you scroll down. Yep. So there might be some questions you all may have that are frequently asked. We've thought of, and Julie has kept track of as many as possible so she can answer those, so that if you need answers, they're right there. If you keep scrolling down, please. Yep, go ahead, keep scrolling. We have all of our town hall meetings there for you all to see. There's recorded versions. If you need to go back and look at any of the other town halls that we have recorded, they're all available there. We also want to make sure that you all are receiving any and all information we have, even after this town hall. If we have any more updates, we'll put them right there on the website, or you can call us. We also have included all our contact information on our website. Julie, where did you put that information? Yep, there it is. So if you click on that, it has my name and my email address and the majority of us sitting up here in case you ever need to contact us. We have also the other grouping email addresses are more for our provider agencies. If they have questions, they know who to send an email to. We also wanted to hear from maybe some of you all where you think or what would be more helpful to you all for us to put information on our website. Does anyone have any suggestions or comments or things that you all may find helpful? Yes, Dana.
Hello. Just for the community members or families or guardians who don't have access to internet, what do you suggest they do to get the same information?
Oh, that's a great question. For those of you who need it, you know what? You can give me a call and I will print it out for you all and throw it in the mail, if that works. Yep. I'm more than willing to help, or any of my employees here. They're more than willing to do the same thing for you all.
Okay, can you guys explain why they changed from Blue Sky to TRE
Yes.
and why the individual case manager didn't reach out to us individually instead of having community meeting? I'm like really shocked that you guys did it.
So we actually sent out joint communication to all the members when the transition started. I apologize if you didn't get the letter. But right now CBE, they have all your information because we're not the case management agency of record as of yet, not until 3/1. We don't have any of your information.
Okay.
Just what Colorado Blue Sky has provided to us.
Okay, that makes sense now.
So the reason why
Sorry for
this,
my abruptness, I just want
no,
to ask.
that's okay. it's better to
Sure, I'm not
ask.
The only one thinking that.
Yeah. The reason for this change, the federal government has told Colorado they need to come into compliance because they want to make sure there is no conflict of interest. So if you'll see throughout the state of Colorado, prior the community center boards or the CCBs, they were both the case management agency and they could be a provider. The Fed said the state of Colorado, actually throughout the United States, they wanted to make sure there was no conflict of interest. So at this point in time, case management agencies, CCBs, SEPs, CMAs, whatever you want to call them, they were told you have to choose, do you want to be a case management agency or do you want to be a provider? If you want to be a case management agency, you have to divest yourself from being a provider, make it its own separate entity, but you can no longer do both.
Okay.
Yep.
That it's kind of confusing when you first hear about this
Yes,
online from other special needs parents and stuff.
yes,
So thank you.
yes. Really, one of the things, it's kind of rolled up all together in one big bundle. Because they also want to do what's called no wrong door. Right now in Pueblo County, you have the SEP, which is Pueblo County DHS, and the CCB, which is CBE. What we stakeholders have told the state of Colorado is it's very difficult to enroll into services or know which waiver service you want, because if my loved one qualifies for two different waivers, one may be non-IDD, one might be an IDD waiver. Right now, currently, if you wanted to enroll in the elderly, blind, and disabled waiver, but you qualify for the SLS, you'd have to go to two separate entities and do two separate intake processes that are identical. We can't do one assessment and you qualify for everything. So they wanted to make sure what they called it was no wrong door. Doesn't matter which door you knock on. It's kind of like, you can think of it like a super Walmart. Instead of just going to Walmart, now you have a super Walmart. That's the way they were thinking. They wanted it really to make it less complicated for families and members, because we know how complicated the system is. They're trying to make it less complicated. But those are great. That's a great question. We have also secured a new building here in Pueblo County. We will be at the Wells Fargo building, and the address is 201 West 8th Street, Suite 600. Our main telephone line will be 719-601-9991. We also have a toll-free number, 1-877-423-323. And this information is also on our website, just in case you didn't get that. And like I said, you can always email me or one of my employees, and we can provide you that information as well. Whatever you need, we'll make sure you get it. The Wells Fargo building, the main reception desk will be open to the public as of 3/1. You have to mind our construction. We're leasing the building from Pueblo County, and so they're still going to be doing some construction there. So, but we will be up and running. Just wanted you to know, if you come to the office, it may be a little bit, noisy, but we will be there. Any questions so far? Y'all are a quiet bunch tonight. Okay. No, I like all the questions.
So as of 3/1, we'll find out who our case manager is.
Yes, hopefully before then. So to provide you a little bit of information, TRE did have a hiring fair with the CBE employees. Many of them are coming over. There are approximately 6 case managers who have decided not to come to TRE. Those 6 caseloads we will need to disperse to other case managers. I'm trying to work that out right now and figuring out who needs a case manager, doesn't, but we are really, really trying to make sure that there's no disruption to in your case manager. We've heard at the last town halls that many of you are very happy with your current case manager. So we're trying to keep most of that intact. I can tell you for certainty that the children's waivers, though, we will pretty much have to disperse those caseloads to new case managers. So I hope that doesn't cause you all too much heartache, but the Easton, who I believe was the major case manager at CBE, this is Janine. Janine will be getting the majority of her caseload. So she will be the new case manager primarily for all CES and CHIRP kiddos.
So if you do have a CES or CHIRP kiddo and you want to see me afterwards for a few minutes, if you have questions or anything, please come to me. We want to make sure that service plans are getting done, 100, the assessments, the things that normally Colorado Blue Sky got done. We want to make sure that those are being followed through and, carried over. So if you do have a CES or CHIRP kiddo, if you want to come see me afterwards, please feel free to. And if I don't have the answer for a question, I will find the answer for you. Just give me some time and we'll get back with you. So I hope that alleviates some stress there.
Let me ask you another question. So my son gets city lift through Medicare. Who will send out marches? Just so he is so OCD about that stuff. He's autistic. So if he doesn't have it in his hands, he'll obsess about it.
So I'm glad you asked that question because we heard loud and clear that bus passes are very important to you all. Amy, she is already going to start purchasing, if she has not, the bus passes and city lifts for March. She will be handing those out at the end of the month like she usually does. And for those of the members that like theirs mailed out, she's going to mail those out.
Yeah, we're going to go down this week and purchase them just like we normally would. And they'll be available to be picked up if you pick them up, or we'll mail them out, or everything's normal, just like it usually is.
Will Colorado Blue Sky still provide some of those bus passes as a day program for their members? Well, so like I know right now your case management agency basically takes care of bus passes. Once your case management agency isn't there anymore, are you guys going to still provide those bus passes through the waiver as a service to the people that attend BAS?
They would have to, TRE will be purchasing them after March.
Yeah, after March, we will purchase those. Yeah, does that make sense, Megan?
Mm-hmm.
Okay.
So we're going back to TRE purchasing bus passes, not the passes? Because we got away from that. Right?
No,
They get billed through the plan, through the waiver. So we would purchase them as Blue Sky, and now TRE is going to just take over and do that, starting with the April ones. CBE will do the March ones so that there's no disruption and nobody doesn't have a ride coming March 1st. And then TRE will purchase them going forward.
So we had historically done that, but we were responsible for dispersing them after. So I think what Megan's wondering is just, will Blue Sky be dispersing them to your, after TRE pays for them, will you disperse them to your clients at day program? Or will TRE be delivering them?
Because, sorry, I'm getting confused and I want to clarify. Remember, after March 1st, CBE staff will be TRE staff. So TRE will resume.
No, I'm talking about day programs. So I want to say about a year ago, it was in May. TRE used to, as the three of us know, or maybe Janine doesn't, she knows, we used to have to get them for our people that get bus passes and deliver them as service coordinators. And that went away last May. All the people that got bus passes now get them through their day program or their residential program. They go out, they purchase it, and they provide it. And it's just a waiver service. So I'm wondering if we're gonna have to drop off bus passes again, because that was not fun.
No, you,
I can add to that.
Yeah.
Thank you. So yes, about a year ago, bus passes ended up being put in the service plan for the day
Could you hold the
program
mic up
provider.
closer so
I'm
people-
sorry, for the day program provider it was put into the service plan under the day program provider so that they could go pick up the bus pass, pay for the bus pass, and then they were reimbursed through the waiver for it. So I'm thinking that your question is very much like mine was going to be, is that going to transition back to how it was originally, wherein TRE would just purchase the passes, or is it going to be up to the day program provider to have it put in that service plan to purchase the pass, to deliver the pass, and then bill for reimbursement on that pass?
well, it sounds like we will continue with that process.
Okay.
But I have to say that with a caveat, because there are some members who go to CBE's office, correct, and pick them up.
That is
And-
correct.
And you want it to stay that way, correct? Okay, so it looks like we're gonna have to do both. But Megan, you as a case manager will not have to drive around Pueblo dispersing bus passes. They have a system set up right now that sounds like it's working. Some providers purchase the bus passes and then they bill the waiver, they're reimbursed. Some members like to pick them up at the office. Some members like them mailed. I don't think we change any of that.
Nancy.
Just because we're TRE.
Currently, we don't have any providers that bill for bus passes. CBE goes and purchases all of them. Bus passes and city lift, we put them at the office. Those that want to pick them up, and then we do mail out a few. So we don't have any providers that bill for them currently.
No, but we have some of.
Yeah, I'm just
We
saying
do.
CBE doesn't
Yep.
currently.
But as the resource exchange, we will do all three. Whatever works for members, that's what we're going to continue doing.
Just to add to that, it may be worth noting that our West Second location will no longer be open to the public. It will go up for sale. This will be our primary administrative building. Go ahead.
Yes.
Just curious that the current members that attend Bass will get them delivered at Bass, assuming, right? Like the
It
bus pass.
sounds like that's what's
Okay.
being said.
Okay.
Is that what's being said?
I'm
Kind of.
I'm
saying,
not super clear on the process myself, but it's,
so right now, currently the members that attend Bass, what does that look like?
Well, I know that the CMA was the one purchasing for all whoever was needed one, and then they were, I don't know, assuming a staff member would go and pick them up and deliver them to people at program. I don't know.
A few people from a staff member would come pick up a few from West Second. Most of the people would come pick up their own, or we would mail out a few.
So that's what's going to continue to happen.
So let me clarify my understanding about the bus passes. The reason we stopped doing that is because what you talked about before, TRE purchasing the passes
Mhm.
is then providing a service to get reimbursed. And then you said, remember the wishy-washy, we're not just a case management agency, but now we're providing services. So us doing the bus pass was us providing a service to get reimbursed for. That was why it was having to be done through whatever programs they were in. Am I correct? That's what my understanding of why, because then it became, we were providing services. Yeah, exactly. But we're getting paid, yeah. That was why it stopped.
Okay,
I was just trying to add clarity.
okay, thank you. Okay. Is everyone clear as mud on bus passes now? Okay. Yeah.
Nancy, would it be fair to just say that March's bus passes are taken care of? We will be situated, and we will make sure we have some communication about what happens with April, just to clear up that muddy feeling I think everyone's walking away with right now. But I think the ultimate takeaway is that we hear how important bus passes are to everybody. We want to hit the mark, and we don't want to have any disruption in service. It sounds like we just need a little bit of time to figure some more details out.
Well, and I don't want to disrupt what's working right now. So if there's 3 different ways we have to disperse bus passes, then there's 3 different ways we have to disperse bus passes. I don't want to, to me, it's maybe not rocket science, but that's just me. Okay.
We have a couple of online questions. So the
Okay.
first one is, when will we be advised of who our case manager is?
Before March 1st.
Okay. And how will we be contacted regarding our case manager?
I'm hoping to send out mass emails or not mass emails, mass letters. Is that the best way to tell everyone? Because I can tell you, us calling all those people may be an impossible task. But I want to see what works for you all, because it's not about me, it's about you all. Hold on. Yeah. Hold on. Make sure you get a mic so everyone online can hear.
I think mail and email, because I mean, what we've learned through this process is people didn't get their letters for the first meeting of this till almost a month later, right?
Yeah.
So I think that's an important piece. Not everybody gets their mail on time, all of that. So I know as a parent, especially with like the Medicaid denials that are happening, right? We're being notified after our kids lose Medicaid at the moment. And so I think we need email and mail. I don't think that it's beneficiary to do one.
I agree. So for those members who want it via email, Amy, do you have their email addresses?
I'm wondering if it's going to happen before the end of the month. Can't the case managers at CBE just let them help pass that information on?
They can, but I want to make sure that, because it sounds like many of the members, I'm sorry I didn't get your name. Dora didn't get a letter at all. So I want to make sure that they are provided that information.
Sure.
Does that make sense?
And I guess it would be confusing to me to say that that you guys don't have a lot of the emails, being that that's how a lot of us communicate with our case managers. No, I'm just saying, I feel like a lot of parents have it more than maybe the database isn't built. to where it's all together, you know what I mean? But
Yeah.
I feel like they're probably out there a little more.
I know right now I don't have it, except for like Terry, I have your email because you gave me your card, but I don't have, unless you're a provider, I don't have many members' email addresses at all.
Nancy, there's a question in the group about whether or not there's some paper we could start tonight where they could share their information.
Definitely.
I don't know if we want to pass that around, if we want to just leave a paper on the table at the end. What would you like to do?
So let me add to that.
We got
really quick.
paper.
Let me-
Do we have a pen? Anyone? We got a pen. We got paper. We're good.
Let me add to that really quick. So I recommend when you put your name, put your child's name, please, and what waiver they're on. Because there's a lot of waivers we're dealing with right now because of the one case management agency. So please put, like, if they're on the SLS waiver, which is the supported living service waiver, the DD waiver, CES, which is the children's, and the TRE. So just make sure you put your email legibly, and maybe a phone number and your child's name, and you as the parent or guardian, or to put that so that we're specific.
As PASs, maybe that's one of the things we could all partner with you guys on is we have our caseloads, right? And so maybe you tell us who's going where, we could send that information out because we do. I mean, every person that we serve, I have an email address for either them or their provider.
That's the
Right?
beautiful
So maybe something
suggestion.
like that. And
Yes.
even like for the CES waiver, I mean, I would be happy, as you know, send out a thing and say, hey guys, give me your email so I can get it to TRE so that we could get that communication out. I mean, I belong to enough parent groups to make a lot of that happen.
That's a wonderful suggestion, Terry.
I will give out, like, if you're on CES, or it's okay. If you're CES or CHIRP, I'm more than happy to give you my email address this evening. And email me. And just like I said, I'm taking over the CES and CHIRP. So there is a lot. So just give me some time to kind of go through emails. Because I really do want to get to know each of the providers and the families, and everything. And so yeah, so we'll chat afterwards.
Yes, please add your email address if that's your preference. I'm happy to, like, one size doesn't fit all. Like I said, even with the bus passes, one size doesn't fit all. We want to make sure and meet your needs how you want them met, not my preference.
And Nancy, maybe for the family up front who didn't get a letter, maybe we can connect with them after and just get your address so that we can make sure it's correct and we have that and we can fix that for next time.
Yeah. Yes, thank you. Another thing I wanted to notify this group about is you all know about all the changes going on within the state of Colorado. We have the PHE unwind, which someone talked about financial eligibility and families not receiving the services they need because you all haven't had to fill out a redetermination packet for financial eligibility since the pandemic started. Providers not getting paid because there's a break in financial eligibility. Even us as a case management agency, we've not received payment because of the financial eligibility breaks. Most of all, it affects the members. We are hearing throughout the state of Colorado that a lot of providers, specifically small ones, can't continue to operate, even the larger ones, because of all these massive breaks in eligibility. We have the new caring case management system that rolled out July. that is not functioning appropriately. They fix one thing and 10 other things break. We know that's happening statewide. This whole case management redesign, conflict free, a lot of balls in the air, and it's somewhat destabilized the long-term care services and support system. The resource exchange, Colleen Head Bachelor, who is our CEO, along with a lot of the big Denver Metro CMAs, our alliance group, some providers, we have brought this to the Joint Budget Committee's attention, along with the Colorado Department of Healthcare Policy and Financing, that listen, we need help. We need to fix what's going on statewide in Colorado, because ultimately the people being affected are members and families. They're going out with they're not receiving the services they need. They're not getting their Medicaid. They're not getting their prescriptions. We need this fixed. HICPUF and the Joint Budget Committee has listened. They are working towards a resolution. We don't know what that resolution means right now, but we're in the beginning discussions with them. And as soon as we hear what the resolution may be, we will communicate that to everyone as well. But we wanted you all to know that we understand that members are being affected, your loved ones. And we're trying to fix that. A couple of other things that have came down the pipe since then, starting yesterday, they have done away with what they call level of cares and DSS1s. What that is our communication method between the case management agency and the Department of Human Services. So when someone comes through the door, or a CSR, we have to fill out a form. It's called a DSS1. We have to send it to the Department of Human Services along with the level of care for them to approve or deny financial eligibility, and vice versa. They have to send that to us when they approve or deny someone. Our systems are now supposed to be able to talk to each other. Now, mind you, now this is a manual process. It's a back and forth between us and the Department of Human Services. Now their system, which is called CBMS, and ours is the bridge, now talk to each other. So we don't have to send these documents back and forth to each other. They're supposed to automatically talk, and one system is supposed to automatically update the other one, to eliminate and streamline eligibility for all the members. We don't know if we're cautiously optimistic that that's working and it's going to work appropriately, but we will see what happens March 1st. Knock on wood, but if you're a member, and I'm not sure in the audience here, do you all know what a continued stay review is, or your annual assessment? Do you all know what that is? Megan, you're a case manager.
I hope, Megan, that you know what that is.
So every year you have to go through a mini version of the eligibility process again. It's annual. That's when you meet with your case manager. You tell them what services you want, what services you need, the units, etc. Well, that's part of the eligibility process. We do what's called the 100.2 assessment. That means that you're functionally eligible for services again. We then send all the financial documents, the level of care, all that to Department of Human Services for their approval. But during that process, it's supposed to be more streamlined now with us in the Department of Human Services. So I just wanted you all to be aware of that it's coming down the pipe. So where I was going with that, if your continued stay review or your annual assessment is a March 1st start date, we have seen in the system that our system is already closing your eligibility as of 2/29, but it should automatically update on March 1st. We've seen the closure, we haven't seen the opening. So we're keeping a really close eye on that to make sure that those 3/1 start dates don't have a break in service. And I don't know if that was too confusing for you all. I was trying to, yeah. But I wanted to make sure the family and members, did that make sense to you? Cause, okay. Maybe you can explain
It's
it.
been a long day. I think
Yeah.
essentially what Nancy's saying is that TRE systems will now talk with the County Department of Human Services. So instead of having to send paperwork back saying, yep, we found them eligible, here are the dates they're eligible, it goes into the system and the systems will just talk to each other. And it should auto update your eligibility every. Who will let? That is a great question. Who will let them know?
Well,
I mean,
we will. Well, your case manager will. So I don't know if you know, is this your son? So do you know what your son's? Yeah. Yes. Okay. Yeah.
do you know what your case manager's name was? I don't think she unfortunately was coming over with us.
Mm-hmm. No. We'll get your name and telephone number. I really want to get your son's name so we can look in this system and see if we have to worry or not. I'm assuming if you just had your assessment, it's probably a 5/1 start date, so there should be no.
Right now we're fighting a couple weeks ago with, I don't know if that makes it, but Social Security cut some payment, and they're saying that, and I've never had any interaction with them since before the pandemic. They've never asked for any information. And so I went down there and she told me that I reported changes in June, October, and for some reason, January 1st, they're not even open January 1st. So I got in an argument with them downtown, and I don't know how to, I sent her an email, his case manager, an email there, but it's super frustrating because I did that with Medicaid, like I said, back in 2017 and right before the pandemic. And I ended up winning, but it was really stressful, a whole year of fighting with him just to get benefits that he actually deserved.
Yeah.
So, and then I'm going through that again. So we're on the DD waiver, which is way better than the CNA program I was on. I think for us, it is a lot better. So I just don't want to lose that. And so like the way you're talking earlier is like, you know how it's going to work. Might cut services. I'm like, oh shoot, here we go again. You know, I mean, should I save money, put some aside, which you really can't, you know? So that's knowledge.
No, we'll get your son's name. And we'll follow up with the county to make sure. And we'll look in this is, well, Amy, you'll look in the system and tell us.
I appreciate it.
Yeah, because we don't want him to fall through the cracks. I'm actually worried about those who had their assessment probably in June or January. Yeah, January, February, yeah.
I think we just had ours, so I'm pretty sure a couple of months ago. Yeah, a couple of months. I'd have to look in my phone. I have it off, but because I usually put it in there when she's gonna come out to the house to do the assessment. So sorry about, I'm not good on the dates.
No, that's okay.
I'm good at taking care of him, so
Yeah.
that's all.
No. But
And that's the important job.
yeah. And we'll get his information. We'll make sure he doesn't fall through the cracks. And believe you me, we advocate hard for our families. So yeah. Yeah. Yep. Go ahead, Terry.
So for instance, my daughter lost Medicaid everything as of February 1, all because the system all of a sudden pulled a thing saying she had life insurance and she was the beneficiary on her own life insurance policy, right? So 7 hours later of me trying to get a hold of DHS, not getting an answer because I call for an hour because that's who my case manager said I had to call. She couldn't help me. I had to call DHS. So I called DHS, spend 7 hours on the phone, get a voicemail or hung up on after being an hour each of those times. That's what their system does. So how will you guys support us as families differently to help get that done? Because I mean, I did get hers fixed, but it was because I knew a person that walked into the supervisor's office and got it fixed. Well, that's not fair to us as families. We shouldn't have to know a person to get it fixed.
You know, Terry, we believe that really it does take a village. And so for us, community partnerships are imperative. In El Paso County, we have weekly meetings with our Department of Human Services, and we send lists. We're like, listen, these are all the people that have breaks. These are all the people. And right now, we've come to a partnership with Department of Human Services that they actually have their techs rotating in our office. And so if a family comes in and needs support and we're like, hey, we need to work on these together, that we have a tech there from the county working in our office to help work through these cases. We're hoping to do the same here in Pueblo County. I know I've already outreached to the Department of Human Services here in Pueblo. I've asked if they would like to have joint meetings with us, attend our provider meetings, talk through that, because we want to be sure that we're all working towards the same goal. Without that partnership, I mean, I can tell probably each and every one of you has gone through some type of Medicaid hiccup like this gentleman did. But we want to help work through those so that you all aren't left scrambling and a year later you get it fixed. Like, we really want to fix it as soon as possible, but those partnerships are very, very important.
Nancy, we got a question back here now. Okay.
Question is regarding the case managers. I know since my son turned, since he turned 18, and I've probably had 2 or 3 case managers that have stuck around for a while. Right now, I don't even know who his case manager is, because the girl that was his case manager for about maybe 2 months, I got a letter saying that she's no longer going to be his case manager. So how do we find out who's taking over to carry over from Colorado Blue Sky to TRE?
So Colorado Blue Sky to TRE, we're still working on those caseload lists. But do you know who your son's case manager was?
Sierra Monroe was for, I want to say, maybe almost 2 years. And she was really awesome. I mean, she really connected and made sure that, she checked on him but right now, I think this last one, her name was Melissa. But I've talked to her maybe once. I mean, no one, like I said, I've had probably since he turned 18, I've had maybe 3 case managers that stuck around for maybe 2 years. The rest, I've had multiple for him, and it's just been a little frustrating because then I get in the mail a letter saying, I will no longer be his case manager. And it's just, I don't know, frustrating when you don't know who's going to take over and where you need to go.
I believe Melissa's still at CBE, correct? Yes. So you're talking about Melissa. Okay. That makes sense. Okay. We'll get you the name of your case manager soon.
Thank you.
Mhm.
Ron Higby. I'm a mentor for a young adult with special needs. I don't deliberately mean to do this, but what is TRE going to do about a life skill / self-sufficiency program?
You have to provide a little bit more.
I also work for a nonprofit organization that assists low income and no income individuals. I hear constantly, who do I go to learn how to open up a bank account? Who do I go to learn how to get a job? Who do I go to, if I need help with housing and how to finance?
So life skills, usually that happens through transitions programs with the school district.
Well, I'm talking adults with special needs.
So are you talking more of like, are you missing providers here in Pueblo County that don't provide the life skills program? Like,
Yes.
so what we can do is outreach to all the providers within Pueblo, but you might have to be open to those providers in El Paso County moving down here or from Park or Teller to provide more options as providers than what you have now. But we've heard both sides of the story that you all don't want anyone from El Paso County moving in to Pueblo County, but we're stuck in a conundrum because providers, we don't pick. The Resource Exchange, CBE, we don't pick them. They have to go through the Colorado Department of Healthcare Policy and Financing to set up provider agreements. We're willing to ask everyone and all to come down to Pueblo, but you all have to be open and receptive to that.
The group that I work with, we're open to any information that we can get to help these folks.
Okay. Well, we're more than willing to talk to our providers and have them transition down here or vice versa.
Okay, thank you.
Yeah. Are there any other questions? Any online? No. You need to say anything, Anthony? No? Any of you all? Are we good? Oh, okay.
Are you guys open Friday? The new TRE?
We are open on Friday, but on Fridays we're open 7:30 to 11:30. We do have an on-call system as well. And I can tell you the majority of like myself, Heather, Cherie, we work all hours. I mean, if we're online, or you call us and we're available, we answer.
Just to clarify, that on-call is for critical incident reporting and emergency situations. Because we do occasionally get calls that say like, hey, I need someone to order me a pizza tonight.
Yeah.
Those are not appropriate for the on-call, but if you have a true emergent need, it's either Angel or Jacqueline answer that phone, and they are super sweet and are willing to try and connect people in those emergency situations.
Yeah, we won't order pizza for anyone, sorry. Yeah. Dad, he wants pizza, I think. All right, well, thank you all for joining us tonight. Like I said, my information's on our website. If you all need to reach out to me, you're more than welcome to email me. Let me know any questions you have. Make sure we get your son's name in.
And there is a piece of paper on that table over there. So if you have an email address you want us to connect you with, make sure you stop by that table before you leave. Yeah,
Thank you.